What is the synovium's role in raw joint inflammation? Imagine your joints as tiny, busy communities where tissues work together to keep everything moving smoothly. In rheumatoid arthritis, one of the main troublemakers is the synovium, a thin lining that surrounds your joints. Under normal conditions, the synovium produces a small amount of fluid that lubricates the joint and helps it move easily. But in rheumatoid arthritis, this lining becomes a hotbed of activity, leading to inflammation and damage. The process starts with the immune system, which mistakenly targets the synovium. Autoantibodies like rheumatoid factor and anti-citrulline protein antibodies are present even before symptoms appear. These autoantibodies form immune complexes that deposit in the synovial tissue, activating the complement system, which is part of the immune response. This activation attracts immune cells, especially macrophages, to the synovium, setting off a chain reaction. Macrophages in the synovium normally help keep things in check, but in rheumatoid arthritis, they become overactive. They release inflammatory substances called cytokines, including tumor necrosis factor alpha, interleukin-1, and interleukin-6. These cytokines amplify inflammation, causing the synovium to thicken and become more vascular, meaning it develops new blood vessels to supply the growing tissue. These new vessels make it easier for more immune cells to enter the joint, fueling the cycle further. Fibroblasts-like synoviocytes are another key player. These cells, which usually help maintain joint structure, become activated and produce chemicals that recruit more immune cells, especially Th17 cells. These Th17 cells releases interleukin-17, which further stimulates the synovial cells and macrophages to produce even more inflammatory cytokines. This creates a vicious cycle of ongoing inflammation. As the inflammation persists, the synovium's blood vessels grow and change, making it easier for immune cells to invade the joint. The adhesion molecules on blood vessel walls help immune cells stick and stay in the synovium, maintaining the inflammatory environment. Over time, this persistent inflammation damages the cartilage and bone, leading to joint deformity and loss of function. Understanding the role of the synovium in rheumatoid arthritis shows how complex and active the joint environment becomes during disease. This knowledge has helped develop targeted treatments, like tumor necrosis factor inhibitors, which can reduce inflammation and slow joint damage. If you suspect you have rheumatoid arthritis or are managing it, always consult a healthcare professional for personalized advice and treatment options. Remember, early intervention can make a big difference in preserving joint health and quality of life.